Hi, everyone. Thank you for joining our virtual dental shadower session. We want to remind you that we will not be having a quiz today, but you can find more information about our page in our Instagram bio using our link tree. All right, let's get started. We are very fortunate to have Zoha today for today's session. I'm handing you the mic. Feel free to start whenever you want. You can begin.
I think that's my cue to start. Okay. So hello everyone. My name is Zoha and I go by pronouns she and her. And today I'll be talking a little bit about my journey into dentistry and how I got where I am today and some of the things that I've learned along the way. So a little bit of background. I did my undergraduate studies at the University of Toronto and I completed a double major in health and disease and physiology at the downtown campus. So I took a lot of courses from different departments such as immunology, physiology, biochemistry, etc., and somehow managed to get my prerequisites as well. And when I was doing my undergrad, I was very heavily involved with biomedical research in Lyme disease, which actually falls under the Faculty of Dentistry and Medicine both. But I did not really like the kind of research that I was doing at that time, and I realized that I wanted to do something that had more of more immediate impact on people around me. And I thought that me working with mice or cell lines wasn't really giving me the kind of experience that I wanted to. And at that time, I was working with a youth-led organization on health promotion, and I got exposure to public health. So that's how I got inspired to pursue my master's of public health at McMaster University, which is a 16 to 24-month program, depending on which stream you're a part of. And at the same time, I also had the privilege of completing a graduate diploma in Water Without Borders from the United Nations University Institute of Water, Environment, and Health. Now, when I was doing my master's, I completed a project on access to oral health care for seniors residing in Hamilton long-term care homes. And I learned about like the policy side of oral health care and realized that there's a lot of need and there's a lot of gaps in the provision of dental care. My professor, who marked my assignment, she thought I did a great job and encouraged me to reach out to a public health dentist and just speak to them about my interest. And after some time, after I spoke to the public health dentist who encouraged me to shadow some dentists, I ended up deciding that dentistry is something that I want. So that's how I ended up at University of Toronto, currently finishing up my first year for the Doctor of Dental Surgery program. So that's my convoluted yet simple journey to dentistry. Now, going into DAT, now it's been some time since I wrote my DAT. I think I wrote it in 2019, so it's been 2 years. Or actually 2018, I can't remember really. But some of the tips that I was able to reflect upon are things that I did or things I wish I did were starting early And starting months in advance, if possible, especially if you're taking a full course load, it can be very hard to balance school, extracurriculars, jobs, and DAT and applications at the same time. So if you get a head start, it can help you reinforce the material multiple times and really be ready when it's time for you to write your DAT. I also like to study in short time blocks, so a few hours a day as opposed to cramming like all biology over a few days. It's just better for long-term retention if you're doing studying in short time blocks. And again, like this may not work for everybody, but just knowing yourself and how you work or study the best is the ideal scenario. The other thing, so this is something that I was a little bit hesitant about, which is like spending money, because let's be real, it's expensive to write DAT once, and if you have to write it multiple times, that's a lot of money. Then it's also a lot of money to buy prep materials. I personally try to find as many free resources as I could, but soon enough I realized that I needed to study a little bit more, and I needed more practice tests, etc., to be able to do well in the DAT and not end up spending too much on just writing the tests. So really make that decision and see that if you think that a paid prep material will help you, then don't be afraid to put in money in that, because it is an investment into your future, and it may end up saving you a couple of years down the road as well. The other thing that I would recommend is trying out different ways of studying. So I knew this from my undergrad that I like to study a little bit of everything at the same time and carry my different courses together. Other people like to focus on one subject at a time, and really knowing your strength will help you study for the DAT better as well. And then when it comes to sections like the perceptual ability test or PAT or the reading comprehensions, practice is the key. The more you practice with strategy and intention, the better you'll get. If you're just practicing to get the questions right, you may not be developing a strategy to help you during the actual test. And that brings me to my last point, which is find what strategies work for you, and that may be different from what other people may find helpful. So I know there's different strategies to do reading comprehension, like you can either read the whole passage and then go do the questions. Other people read the questions first and then they go do read the questions first and then read the passage, or you can go back and forth. So try different things and see which one helps you get most questions right and the one that helps you save time as well. And playing that out with different strategies will help you find out what really works for you. And if there are other friends of yours who are also studying at the same time, don't try to get carried away by what they're saying, because each person has different strengths and different ways of studying. I did want to give specific advice on writing the PAT. That section in particular was my worst one, and I think I'm not alone in this. A lot of people struggle with perceptual ability because for some people it comes naturally. For other people, it may take some time to develop those skills. Some of the things that I learned through that journey of, learning how to use my perceptual ability for the DAT test, one thing to consider is playing with your strengths. So knowing, I can guarantee you that there is probably one section that you're stronger at among all the 6 sections within the PAT. So if you are able to do those subsections that you're automatically good at or good at naturally, you are maximizing your chances of doing well. So I would do those subsections first and then spend time on the ones that you're not as strong at. And I would also try to have a backup strategy. So this is something that I learned through my undergrad experience, where I found that sometimes if I have no idea what's going on and I didn't have time to study, my backup strategy would be at the end, if I don't have time, I'm just gonna read a few questions really well and answer them properly and get them right. Other people may rely on the strategy that I'm just gonna pick all the B's and hope that some of them would turn out right. So having some sort of backup strategy, especially for The reading comprehension and PAT will help you not panic in the moment in case you are running out of time. Hopefully that doesn't happen. The other thing I would mention, just following up on starting to practice early, is that perceptual ability is something that may take some time to develop. So if you're not seeing results overnight or over a few days, actually, just be patient with yourself and really understand why the questions you're getting right are right and why the questions you're getting wrong are wrong, and really reflect on that, and that will help you develop your own strategy. And then the last thing, which will help you through your dental school as well, which is learn to reason through your selected answers. So I've written like 20 plus exams this past 1 year during my first year of dental school. And one thing that I've learned is that if I read a multiple choice question, I should know the answer even before I get to the options. And when I get to the options, I read option A and then I think to myself, okay, why is this option correct? Or why is this option incorrect? And reasoning through that gives you a little bit more confidence in the choices that you're making. And it also saves you time at the end where you're trying to rush through and review all the questions, because you already went through the reasoning why an answer is the correct one. So that's my last tip for the PAT. And also don't overthink it. I found myself like getting lost in the angles portion. I would just like keep looking at like one question and spend so much time. And the thing with the PAT section is the more you overthink it, the more likely you are to get the question wrong. So go with your gut, select the first option that you think your gut is telling you is correct, and then just move on. And don't take your sadness from getting like one subsection wrong or not doing well into the next subsection, because each one of them are graded separately and it's a fresh start for you to do well in. So those were some of the tips on DAT and PAT. Now, some advice on staying motivated. I know like studying for DAT, working on your applications at the same time, it can be very draining, and you may find yourself just sitting there and thinking, what am I doing? Why am I doing this? Like, am I even going to get into dental school? And it's really hard to find motivation in those moments when you are just exhausted about everything. And I found myself there so many times, even after getting into dental school, just finding a purpose to go through it all. And some of the things that have helped me that I would love to share with you are reminding yourself of your long-term vision and goals. And that's something that I've put on a sticky note and just stuck it on my wall here as well, because when I'm studying for anatomy and I don't understand something, I get frustrated, but then I think about why I need to know anatomy as a dentist. I need to know anatomy so I can anesthetize the right nerve. I need to know anatomy so I know where not to do an incision because there's an artery going there. So a lot of these different things, trying to understand why what you're doing right now matters in the long term, it motivates me, and it may or may not motivate you, but something to try. During dental school, I also started taking mindful and intentional breaks. So I'm the kind of person who would say, okay, I'm going to take a break from studying, and then I'll just jump on my email and start replying to emails, or just start working on like something else that is not studying. And I found that I just feel perpetually tired. And the reason for that is I'm not taking mindful or intentional breaks. For me, break from studying should be break from anything that requires me to use my brain, essentially. And so being intentional with when you want to take a break, what your break looks like, whether it's like going out for a walk or exercising or having your favorite snack, watching your favorite show, whatever it is, make sure that you're mindful and intentional, and putting your energy in the right place so you're not like always tired like I used to be. And then some of the other ones are like planning ahead, creating a schedule. I think that's a no-brainer. Like you learn a lot of that in your undergraduate studies as well. And then reflecting on your why and why you're doing this, just like emphasizing the first point that I made. Once you know your why, I think it just internally motivates you to keep going because you know that you have a purpose and why you're doing what you're doing. And then lastly, like, I know you've probably heard this so many times that you need to like eat well, sleep well, exercise well, but it actually works. Like if you're eating nutritious food, not ramen for like 5 nights in a row because you can't cook, you don't have time for it, or if you're pulling all-nighters, or if you haven't moved your body for like 10 hours that you were sitting on your desk for the whole day, like it will take a toll on your mental and physical health. So really put time in for self-care. And honestly, these are some of the things that you will take into dental school with you too. And if you don't have like a strong work-life balance and strong work ethic going into dental school, it will be very challenging early on to get used to the fast-paced and heavy course load environment that we have in dental school. And then I was also asked to share briefly some of the community work that I've done, and I just listed a few things that I did, and I can just talk briefly about some of them. So in my first year, I was very heavily involved with mentorship. I just love receiving mentorship and providing mentorship too, because I think it really helps bridge the gap between different generations of students or different generation of professionals. So I was a part of a program called First in the Family, which is for students who are first in their family to go to university in Canada. So I joined as a mentee, and then I moved on to a mentor, and now I'm a senior mentor with the program. And a lot of times I just connect with other like first generation students who are interested in something in healthcare but are not too sure, then just like supporting them throughout their journey. And there were a couple of other mentorship programs that I was a part of as well. I also did some work with Hamilton Public Health Services when I was pursuing my master's, and worked with there was a project that was being done by the Public Health Association of Canada, and they were looking at different determinants that affect the lifestyle of injection drug users. And I still consider that one particular experience as something that it was very important and very pivotal into forming my ideologies around importance of social determinants of health, and obviously connecting it with oral health because of the profession that I'm pursuing. So that was a very interesting experience, and I talked a lot about it in my personal statement as well for U of T. Another one of my favorite ones is the Visions of Science. Some of you may already know about this organization, but they do a lot of work for at-risk youth, providing them with different like workshops and events. It's like, and you do like different types of experiments to inspire them to pursue STEM as well. So very rewarding, and something that to something that can help you build connections with other people, and also learn how to work with different age group. So through mentorship, I was working with people who were the same age group as me, but Visions of Science helped me learn about different ways to communicate complex information with kids as young as a 5-year-old. So that was also a very interesting experience. And then the last thing that I would just briefly touch upon is Public Health Connect, which is one of the initiatives that I found last year in March 2020. And the purpose or the reason or the why behind Public Health Connect was to bring people who are interested in public health or pursuing public health together, and providing them this a platform to connect with each other, and providing them with different opportunities to build their skill sets. And if you're interested in learning anything about any of these experiences I've listed here, feel free to ask questions during the Q&A. Now, at this particular time, I think some of you may have like multiple acceptances, or you may be wondering, how do you decide what dental school is the best one if you're in a position where you have multiple acceptances? So I was in that position last year. I was accepted to both McGill and University of Toronto. And some of the things that I considered, I put them here. And this is not like an exhaustive list, so there's definitely other factors that you may consider based on what your context is. But some of the things that I thought about a lot when I was making that decision of whether I want to move to Montreal for McGill or if I want to stay in Toronto. The first one is finances. I think that's a big one. But I have a feeling like no matter which school you go to, you will need additional financial support that comes as line of credit or other forms of loans. So finances may be like one of the options. You may be someone who doesn't want to get extra loans to pay your tuition. So in that case, you would probably go with the one that is a cheaper one, has cheaper tuition as the cost of living is cheap too. So that's probably the number one factor that I considered. And when I started like comparing the finances and I brought other factors in, such as if I was to move to Montreal, I would be away from my friends and family. And we think of cost as in the financial terms, but in reality, the cost to your relationships, the cost to your mental health when you move away from friends and family and have to start all over again in a different city, like that cost is also equally important. Just because we cannot quantify it doesn't mean that it doesn't matter. Obviously, for some people, it may be an exciting adventure to move away from family and friends and start fresh. So really understand what you want and what you are willing to sacrifice to pursue your dream. I also thought about research and outreach opportunities. I personally want to pursue something in global oral health, so I wanted to be at a school where there's a very strong global health program where I have a lot of opportunities to pursue what I want to do. And then U of T seemed like a better option because their Dalla Lana School of Public Health is very strong when it comes to their public and global health programs. The other thing to consider is preclinical training and clinical exposure. So when do you start seeing patients? What do you do? When do you start your preclinical training? Like for U of T, for example, we started our preclinical training right off the bat, and we were drilling teeth like in January, which is very early. So just thinking about whether you want more preclinical training, more clinical exposure, the better. So seeing which of the two schools is important, that may help you decide as well. The other one are opportunities to specialize, intern, observe, shadow, etc. I think that's important because if you are someone who is thinking of specializing, like you may want to go to a university where you have more opportunities to perhaps connect with course directors or connect with program directors who are running those specialization programs. And being at U of T, there are 10 different specialties that are offered after the VDS. So I just thought that I would have more opportunities to learn about different specialties that exist and really decide if that's something I want to do. And the other thing that is hard to explain, but I think it's very important, is the vibe. I know it's difficult to judge the vibe during a virtual interview or a virtual interaction. And you cannot really judge it based on, like, you really need to be there in person to decide if there's a vibe match. But it's like about how the environment is at the university. How are students like? Are they welcoming? Like, are you passing by someone and do they say hi to you just because you're wearing the same scrubs? So things like that. It's like how that faculty makes you feel when you're there. And I think you'll get it. It's hard for me to explain it, but you'll get it when you find that vibe check. But anyways, so the other thing that I thought about was commitment to equity, diversity, and inclusion. I didn't want to be in a place or at a school where I'm a minority. I wanted to be at a school where I'm well represented. There are other people like me. And there are things being done to improve inclusion of folks like myself or to increase diversity in the community. And I have access to different leadership positions as well. So commitment to EDI was definitely important. Another thing you may want to consider is if you want to do dual degree programs. So that's more common for schools in the States. So you may want to think that, I want to do like a dual degree, like a DDS and an MBA. So maybe I should apply or consider a school where they offer that kind of program that I'm looking for. So that is another option or another point to think about when picking which dental schools to apply to and which dental schools to or which dental school to eventually go to. And the last point is curriculum type, which is some schools have a more holistic approach to teaching dental medicine where you learn a lot with medical students for a year and a half or so, and then you switch into specialized dentistry focused stream. So McGill is an example of that. So you learn a lot about the rest of the body, and then you take extra courses for dentistry. U of T, on the other hand, is very dental focused. So all you do is teeth, all 4 years, and then you're out. So if you want to learn about the entire body, for example, you want to know how the kidney works and how it relates to your oral health, you may want to go to a program that is more holistic. So, and that's the other thing to consider too. Then in terms of like what my typical day is like, it's very hard to tell because our days, because of COVID situation, our days have changed like on an hour notice. Like this one time I had a biomaterials lab and I'm commuting still. So I was on the bus and I got an email that I've been switched to an afternoon lab. So I could have waited like another 4 hours to get on the bus, but I ended up going anyways because I was already on my way. So there's been a lot of changes because of COVID to make sure that we are complying with the overall provincial requirements, as well as making sure that everybody's safe in the lab, because the lab that we have can accommodate 100 people, which is a lot to have in one room. So it has been very variable, but one of the examples that I could share are in around January, February, when we still had labs going on. I would wake up around like 6 a.m., do a little workout to start off my day, shower, get ready, and then come sit on my desk right here and either watch some of the asynchronous lectures, or if I have any live lectures, attend those. If I have neither of those, then I would get some studying done in the morning. In the morning, it's supposed to be 11 a.m., so 8 a.m. to 11 a.m. And then in the afternoon, I would have my preclinical or simulation lab, usually for 2 hours, just to accommodate everybody. And then after that, I would usually attend to my non-academic commitments and meetings. So I was class president representing the class of 2024. So there were a lot of admin work, managing class council, working with the DSS, Dental Student Society. So a lot of those commitments as well. And then a lot of my other non-dentistry initiatives that I was working on. So I would take care of that in the evening. So a lot of admin work for me in the evening when I don't have to use my fresh brain. But it has changed a lot. Like right now, we are going through summer labs, and this is actually my last week. And what we've had is we have 3 shifts for labs. There's an AM lab which runs from 8 a.m. to 12:30. Then we have PM lab from 1 to 5:30, and then we have an evening practice session from 6 to 9. So you're either coming in the morning or you're coming in the afternoon and then staying for the evening practice. So far, my days have been very busy. Like it's every week the schedule is very different, so you have to kind of just be on top of your Excel file and know when you're in and when you're not. So that's how it's been now. But in the fall, hopefully we'll be able to go back to somewhat of normalcy and have more consistent schedule. But so far, it's been all over the place, and I think one of the skills that we are getting out of this whole COVID experience, or being in school during COVID, is how to adapt to, different circumstances that are just like thrown at you out of nowhere, and how to be resilient through it all too. So I definitely see some advantages, but it would be nice to have a consistent schedule so you don't have to check in the morning whether you have an 8 a.m. lab or an afternoon session. But that, yeah, if you have any more questions about my typical day, feel free to ask. And I think I'm going to end my presentation there, and we'll take some questions if there's any.
All right, now we will be starting the Q&A portion. So the first question we have is, what is the class size at UT? Can you hear me? Can you hear me now?
Yeah, so class size is 96 people in first year, and in third year we get to I think there's 22 internationally trained dentists that join our class, so we go up to 100 and something. So clinical actually starts in first year. In the during the summer labs that I've been having, we've had I've assisted 4 times. So you go in and you assist an upper year with whatever procedure they're doing, and you get to learn about infection control protocols, etc. So so you mainly assist in first and second year, but in third year, that's when you get your own patients where you do general examination, treatment planning, and just diagnose and identify what the problems are, and then plan with the instructors to see how you can address whatever problem the patient's walking in with. So usually the patients come in to the faculty. I think you could refer people or patients, like you can find people, but usually they have to go through a system and they assign them to students who have like capacity to take on. But usually the patients go through the university first, and then they're randomly assigned to a student. So I'm not too sure about that because I haven't been in clinic enough to understand what the range is, but based on what I know, there is like an emergency clinic as well. So if you have like very bad pain that you can't deal with, then there's emergency clinic where you have, I think, I'm not sure if it's run by students or residents, but there is an emergency clinic where they can see you if there's like a very bad situation. But other times you have just people coming in for like general checkup. If, for example, if somebody has been wanting to get their wisdom teeth removed and they're not bothering them, they may just come in and get like the radiographs or x-rays taken and just get a regular checkup so they can see what the situation is and if they need to get them removed. So I think there's a wide range, but you may not be dealing with all of them based on the training. Like if you are a resident, you may be seeing more severe complex cases, but if you are a student still and still learning, then those patients may be referred out to private practice or referred to the graduate programs. Exam schedules are very varied based on what semester it is. For example, in first year, first semester, we had 5 exams in 1 week, Monday, Tuesday, Wednesday, Thursday, Friday, 9 a.m. every single day, no break at all. So that was first year. It was brutal. I thought I had learned the art of studying for exams from undergrad, but this was just too much. Worst experience ever. But the second semester was much better. Our exams were much more spread out, and different courses were ending at different times. So we ended up having like one exam every week. So that was much more manageable, although I felt a little fatigued at the end because of how long the exam season went for us. So there's like variation. That's a great question, and I think something that I can't really answer, just because I don't know how I got in, or it's very hard to tell like what the main factor was. So I think if you want to know what they're looking for, the best place to find that information is either the website, which says you need to have completed your prerequisites. You have to do DAT, get good grades on that. You have to have good GPA. You need to have submitted good quality personal statements and other essays that they require. Do well in your interview. And I think I would say that's what they're looking for. Like if you are an overall great applicant and if you have the skills that you require to be a competent practitioner. That's a very great question. I'm glad you asked. So I struggle, and this is something that I wanted to say when I was talking about perceptual ability part of the DAT, and I wish I talked about it then, but it's okay. So it may feel like perceptual ability is kind of out of context. Like, why do we need to do that for dentistry? But it's actually, you don't do the exact same thing, but I think there is application there. So being able to look at something and understand what you're looking at, what the size of it is, where you're moving, using indirect vision, all of those skills you will be applying in dental school. So something that I personally struggled with was, or I still struggle with, is indirect vision. So when you're working on the maxilla, which is the upper jaw, you cannot work on it with direct vision. Otherwise, you'll be like literally on top of your patient, which is unethical, obviously. So what you do is you use the mirror and you reflect the light off of it, and then you see and you work on it. So initially, when I started working on the maxilla, I found it very difficult to understand that if I'm moving my handpiece to the front in the mirror, which way am I moving? So my brain would get tricked and I would end up going in the wrong direction. Now I have to constantly tell myself that if you're moving forward, that means you're moving mesially. Like it's literally just the same way. It goes the same way as you would expect it to, but I think I'm so used to seeing my reflection in the mirror that I just think that it should be going opposite. So that's something that I still struggle with, and I have to really pay attention whenever I'm working on any maxillary teeth that I am using this mirror, but whatever I think is correct is not correct. I have to do opposite. So that's something that I really struggled with early on. Now it's getting better as I do more and more of the maxillary procedures. But I still have to think twice every time I'm trying to move the hand piece to make sure that I'm moving in the right direction. And that's something that comes with practice too. So I'm not trying to beat myself up for that. Yeah, absolutely. I feel that I have somewhat of an advantage because I'm class president. So every time there's something, a message that needs to be communicated to my class, or if there's a message from my class that I want to like share with the professors, like I have never had a professor that I reached out to and asked that, hey, can we meet? And they'd said no. Usually they're very willing and very approachable, happy to talk to me whenever I want. So I don't know how much of like the class president privilege plays a role in that, but I do think that professors are generally like they care a lot, especially in first year. I've had some great professors. I've had like great chats with them to learn about their experiences, how they got into dentistry, what they've done in the past, and just learning about like life in general. Because I think if you find a good mentor early on, it really helps you grow as a person throughout the school. So to answer your question, yes, most of the professors are approachable, super nice, willing to help and support however they can. But there's always like a few professors, even in undergraduate scene, who are just who are not as approachable. Like you may find them intimidating, but once you get to know them a little bit, they are also fun to hang around. I was gonna say I don't, but I need to. I think it's it depends on what kind of stress it is. So for example, if I have exams, for example, when I had 5 back-to-back exams during my first semester, I was stressed a month in advance because I was looking at that exam schedule and I was thinking, how am I gonna get through that? Because it's like 9 a.m. exam every single day. And for some of the courses, we went all the way up until like the week of exams. Like in the morning, we wrote an exam, and then in the afternoon, we had class for the Thursday exam. So I was thinking, how am I going to get through all of this? So I knew that my stress was stemming from the fact that I wasn't prepared at that time. So I started preparing a schedule to study where I just schedule like study blocks for different courses so I can carry and study for all the courses at the same time and be prepared better than I would have if I left things until last minute. Sleeping also helps me a lot. Like sometimes if I'm just studying late at night, and I'm getting stressed, I just like close my laptop and I go to sleep. Although sometimes if you're pressed for time, that may not work as well. But I think having a disciplined schedule throughout the first year has helped me a lot because I'm always on top of my stuff, and it can get a little bit draining at times because you constantly need to be like up to date on high alert mode. But then you can use your weekends to really relax, wind down, or take long like you have Christmas break or winter holiday, and then you have the reading week, and you can like rejuvenate at that time too. But I think you really need to be on top of your everything that's going on in your life, and that can help reduce stress to an extent because you feel that you are in control of things that are in your control. But other than that, like exercising, taking some evenings off, taking weekends off, watching some TV with friends and family, I think those are also some things that help me. But I think at this point I'm just like always stressed and burned out, but hoping that this summer I'll get some opportunity to like refresh myself, rejuvenate before I start second year.
All right, so that's the end of our session. Thank you, Zoha, for taking your time to talk about your experience in dental school. We appreciate you coming out. To all our viewers, you can check out our Linktree bio and find out more information. Again, we want to thank you for coming, and all the viewers, we want to thank you also. So thanks, everyone, and have a great day.
Thank you. Good luck.